Welcome to Caldwell County Today. I'm Paige Counts, Public Information Officer for Caldwell County. Joining me today is Brittany Bond with Helping Hands. Welcome, Brittany.
Thank you very much.
We talk about every month, but I still think there are people out there who don't know what Helping Hands is or is about. So just give us the big picture of Helping Hands.
Okay, so Helping Hands Clinic is the free clinic and pharmacy that serves uninsured adults in Caldwell County. And so what that means is that we are the primary care and urgent care provider for our patients. We do chronic disease management. So after the patients come and see our physician and get their medical needs met, we can also help them access their medications through our pharmacy. So we have a full-time staff person who does patient assistance program applications to help our patients access free prescription medication. We can also provide antibiotics if somebody's sick. A lot of our patients are on insulin, a lot of them are on blood pressure medications, and we're able to do these things and provide them for free to our patients. Many of our patients make donations to help support their care, but that's not a requisite to be able to come and be seen. So it's pretty amazing what we're able to do, as a privately funded organization.
And I have a question, and I may be wrong because I'm trying to remember during our previous conversations, but sometimes you provide even some over-the-counter medicines, don't you?
We do. That's usually on our wish list. So we have folks in the community who come and bring us items that we need, and often we ask for things like pain relievers, Tylenol or ibuprofen, or the generic versions of those. During this season, cold medications and allergy medications. And we also have some other partner organizations that sometimes will donate those kinds of things to us so that we can provide them for our patients.
So really, I hate to use the term full service because I know there's a caveat to that, but you do provide those basic needs.
Oh, certainly. And what we do in our clinic, our patients get pretty much the same experience that anyone would get at any other doctor's office. We're able to do labs on site. We have a partnership to provide free labs for our patients. And any services that we can't do on site at the clinic, we have a partnership with UNC Health System to help our patients become connected with their charity care program so that they have a really low-cost option for procedures, for diagnostic testing, for specialty care, anything that we can't do in the clinic. So.
Let's talk about your impact in the community because I know it's huge.
Yeah, we're so over the past 26 years, we have cared for close to 31,000 people in this community. We provided more than $300 million worth of care for our patients, and we've dispensed more than 350,000 prescriptions. This year, before the end of the year, we will have completed about 2,000 medical visits for almost 1,000 patients, and we'll have dispensed more than 10,000 medications. And all these services are things that improve our patients' health, which is our mission, and then also help to keep the healthcare costs in Caldwell County down, because a lot of times the alternative to having access to care at our clinic is you go to the emergency room to get the care that you need, because that's what you do when you don't have health insurance. So we, in 2023, provided about $4.7 million in emergency room diversion savings by having access to our clinic. That was, there would have been that much unreimbursed care at the emergency room.
And as I'm sitting here thinking about it, it not only saves money, but it saves those precious resources in the emergency room.
Oh, yes. Oh, definitely. And that's another part of our goal. So our mission is to improve the health of our patients, to provide them with health education, health care, and medications at no cost. But one of our guiding principles is to reduce the cost of care in Caldwell County and to conserve our health care resources. So that's a big part of what we do.
Big part of what you do. Let's take a patient. We'll make up a patient, but to me, it's interesting who you see.
Yeah.
You see people who are uninsured.
Yes.
And I think sometimes we get that a little bit confused. But these are people who may work.
Oh, yeah. More than half of our patients work, either part-time or full-time. Most of our patients, I'm trying to think of another good point about our patients, but employment, yes. We actually have a program called the Worker Wellness Program. We've talked about it on the program before, and it is specifically for employers to help their employees connect with us. So if they I have employees who either aren't going to take advantage of their insurance, or if they aren't able to offer insurance as part of their benefits package, we can be an alternative for those employees if they meet our financial eligibility criteria. And that's something we didn't talk about. So,
Well, let's talk about that too.
so in order to be a patient at Helping Hands, you have to be uninsured. You can't have access to Medicare or Medicaid, and you have to meet financial eligibility, which is 250% of the federal poverty level or below. And so, in layman's terms, that means a family of 4 who has an annual income of about $78,000, the adults in that family are eligible.
Because there's already programs for the children in that family.
Yes, exactly. And that's why we stick to caring for adults, is because what we've really done over the years with the clinic is to try to fill the niches of where we see, uninsured care. What resources can we access through partnerships and through other organizations and other, programs that are built to benefit the community, and what do we need to develop and provide on our own, so that way we can be the best stewards that we can be of the dollars that fund our work. So.
Yeah, I mean, and you really do. You find those niches, and you take care of people who need ongoing treatment in a lot of cases.
Yes. A lot of our patients have come to us and maybe have not, during their adult life, had a regular primary care provider. They've not been too sick, they've not had too much going on, and it's been more important to pay for other things in life, because I think we've all probably had to make those choices before. So what we find is that those folks will end up in the emergency room and find out that their blood pressure is uncontrolled, that they've developed type 2 diabetes, that other things are going on with their health, and then those folks, if they don't have insurance, are able to come to us, and we can help manage those chronic conditions and get them back to a good baseline.
And get the medicines they need.
Exactly, yes.
And I think that's equally as important as being seen.
It is, and honestly, that's another important point I'd like to make, is that if you are financially eligible and do not have insurance, you can get your medications at Helping Hands Clinic. You do not have to be an enrolled patient to be able to access the pharmacy services. We also have a couple of other programs that are for anybody in the community who meets our eligibility criteria. The first is a dental program called Project Smile, and this is a program. We've got grant funding to provide this on a regional level, but we can do extractions. So if somebody comes in with an abscess or a painful tooth, we can get that tooth pulled. We can do fillings, we can do hygiene visits, and we can do some limited oral surgery, and that service is provided for free for folks who meet that eligibility criteria. So.
And that's huge, because
it's an amazing program.
Dental health, I have learned this over the years, dental health can lead to other health problems.
Yes.
Poor dental health, I should say, not good dental health. Poor dental health.
Yes, it can. I mean, you can be looking at a higher risk for cardiac issues and lots of other things if you're dealing with that. Plus, I mean, there's nothing with walking around with a toothache. I mean, there's nothing like that. It's miserable. And so being able to have a resource, and that's also, it's very expensive care. So, I mean, the fact that we have this resource available to the folks in our county, we're incredibly blessed. So we work with some other free clinics that are in our region, in the surrounding counties, and with the Caldwell County Health Department to provide that service. So we are blessed and grateful to be able to do it. And the other program I wanted to tell you about is our mental health program. So we work with a licensed mental health counselor, and she provides services for our patients or for anybody else in the community who financially qualifies. And we see patients on site at the clinic, and then she sees patients at her office. And again, the service is for free. So.
A lot of good services, and you're looking at whole health.
Yes.
That's not a good term, but that's the only one I can come up with right now.
No, I like that. But we look at the whole person, and we try to build our services around, how can we meet the needs that could potentially be unmet, because dental services are difficult for folks to come by if financial issues are a problem. Mental health support, we're underserved in the community with mental health. Our mental health resources are strained. So being able to offer even just a small option for our patients is really special and has made a big difference in our patients' lives.
Let's talk about how you can become a Helping Hands patient.
Yeah. It is pretty easy. So basically, you can either call or stop by the clinic if you're interested in more information. What we usually do is do kind of a pre-screening. We do an intake form that has just some basic information about you as the patient. We verify income and make sure that you meet that eligibility piece. And then we look at your medical records, because our providers on site are mid-level, so we have 2 PAs and a nurse practitioner who see patients on site at Helping Hands. And if there's something that's outside of their scope, we look at other options of how to access care for you. But other than that, then we do an enrollment visit. We get all your information taken care of, and we get you scheduled to see a doctor.
So really, it's a good thing not to wait until you have a cold, flu.
Yeah, if you are uninsured, and we are accepting new patients right now, we are always accepting new patients. But if you're uninsured and you think you might meet our eligibility criteria, give us a call. We'd love to talk to anybody about how we can help.
Let's talk about how people can help you. We're coming up on the end of the year, so a lot of people are very generous at this time of year.
Yes.
So how can people help Helping Hands?
Well, Helping Hands is a service that is provided because of the generosity in this community. I think I mentioned earlier, we are a privately funded nonprofit organization. We receive really generous gifts from several foundations in our community and throughout the state. We receive some funding from the state as well, but I mean, the majority of how we offer the services we offer is because of the generosity of the people in this community. And so this is a time of year when we do go to the community and ask. And again, I appreciate you letting us share about our impact, because I feel like we do some amazing things for the people in this community to not just benefit the patient and their lives, but to benefit our whole community and to make healthcare more accessible for everybody. So the easiest ways to support us are to either go to our website, which is helpinghandsclinic.org, or to come by the clinic, and you're welcome to come and see what we do, and provide us a gift there. So we also accept gifts by mail.
And you accept financial gifts, obviously,
Yes.
but you have some wish list items. So if people want to, maybe they don't feel like financial, they want to do more, or maybe a church group or civic group wants to make a donation. Talk to me about your wish list.
So our wish list is on our website, and then we also can provide that to anybody who asks us for it. But right now it includes bottled water for patients for medical visits. It includes, like we were saying, pain relievers, so Tylenol, ibuprofen, or generics, cold medications. Those are all things that we need right now. Kleenexes, copy paper is one of the things that we need.
You still operate a medical practice and an office.
We have to have paper. So, but those are really the kinds of things that we need right now. And then we update that list. We try to do it like once a quarter, based on kind of what we see the needs are in the clinic. So those are, but we have a lot of generous church groups, community groups that come and they bring things to the clinic that we're able to share with our patients, and it's really awesome.
I'm going to go ahead and ask you, I mean, we're talking about end of year giving, so you can give gifts, you can give money, but you can also give of your time. So
Yes, you
talk
can.
about your volunteer opportunities.
So we have a wonderful volunteer program at Helping Hands, and we accept volunteers to help us with administrative tasks. Working in our pharmacy is really one of the big places that we utilize volunteers. And we also accept the help of professional volunteers. Right now we have a medical assistant who is coming in and spending a day each week with our patients. It's pretty amazing. And then folks who have specialty skills or clinical skills. Like in the past, right now we don't have anyone on site, but in the past we've had diabetic educator who came in and worked with our patients. So we're always looking for volunteers who maybe have skills like that could help improve the health of our patients.
So whether you have medical skills or you're just ready to volunteer.
Yeah. Another need that we have, and I'm going to go ahead and throw this one out there as well, is for folks who are bilingual. So we have interpreters on site, and it's amazing, but there are some times that we just need to return phone calls to our patients who don't necessarily speak English very well, and it's really helpful to have someone who can help us facilitate those conversations. So,
Those people who are bilingual are so vital.
oh my gosh, yes.
I know from county government experience that they're key.
Yes, Well, we have 2 bilingual staff members who work at Helping Hands, and they are, I mean, on a lot of days they're our MVPs. I mean, and they help us make sure that we can communicate with folks and hear and understand what they need. No matter what the language barrier issue is there, that we can have the opportunity to talk to folks in their native language.
Brittany, we've covered a lot.
We have.
Is there anything I have forgotten that we've forgotten to talk about?
I don't think so. I think we've covered everything. Just, again, I would like to say how grateful I am to our community for supporting our mission and supporting our work, and allowing us to be this resource for our patients and to make this impact in our community.
Again, tell us your website so if people want to make a donation, learn more, all the things you can do on your website.
So it's helpinghandsclinic.org.
All right. Brittany, thank you for being here.
Thank you so much for having me.
And thank you for watching Caldwell County Today.